Here is a cardiac patient waiting to undergo the surgery, gets delayed. Why? Here is an orthopedic patient waiting for a knee replacement, surgery gets delayed. Why? Uncontrolled diabetes. Sugar levels are not stabilizing. Surgery gets delayed. These are one of the many reasons why increasingly diabetes is turning very difficult for patients to manage their lifestyle. In fact, it's turning life-threatening today. So, welcome to STAR Hospitals podcast. I have here Dr. Rohini Kasturi, Senior Consultant Endocrinology, joining us here to talk about a couple of topics of interest for all of you. When can diabetes turn life-threatening? Dr. Rohini, can you tell us about how serious is diabetes in a country like India with our population size? Enlighten us about the prevalence and how do we compare with the rest of the world? Anything that you believe is important for our listeners to understand this?
So, according to this study that was published just recently in September 2025 by the Government of India in Lancet, so the prevalence of diabetes in people older than 45 years of age is right now at 20%. Okay, that is 1 in every 5 of us, having diabetes. That's huge. And there was no difference between men and women, but urban population was twice as much at risk for diabetes than rural population. Economic advancement a state had in India, the higher the prevalence of diabetes. So it's getting out of control, honestly. 1 in every 5 is huge. So we do need to address this situation as soon as possible. If we compare it with the rest of the world, because of our population size, China ranks first and we are the next. So we are one of the toppers in the wrong thing.
Very unfortunate. Doctor, let's understand a bit more about what kind of health complications are likely to come to somebody who has diabetes and is not doing a good job in managing the diabetes.
If you look at the cardiovascular disease, which is the number one cause of mortality in non-communicable diseases, diabetes is one of the biggest risk factor for cardiovascular disease. So actually, when you think about diabetes, you don't get scared as much, okay? Because if you say cancer, people get scared. Okay. If you say diabetes, people don't get scared. Okay. But it is high up there in one of the biggest thing that actually kills people. Okay. But we kind of became nonchalant to taking it seriously. Okay. I should also say diabetes is a very forgiving disease in the sense it gives you enough time. Okay. If you look at a person from the time they are diagnosed, right, it gives you enough time to correct your lifestyle, to correct your, diet, to exercise, and to keep your sugars under control. It doesn't happen. The complications, most of the time, they don't happen overnight. Okay, you get diabetes today, you are going to die of heart attack tomorrow. That's not the case. Okay, it actually gives you, it takes time to develop all these complications, usually over course of years. Okay, so during this time, if you don't take care of it, then you develop multiple organ damages. So if the blood sugar is not controlled in your body, it starts to cause changes at microscopic levels, at cellular levels that you will not be able to feel. So it typically does not hurt to have a high blood sugar. Like I said earlier, right? A lot of people are asymptomatic. Okay. Right. So when they are asymptomatic, nothing draws their attention to it. Okay. Changes that happen at the cellular levels with the high blood sugars, these sugars attach to proteins and fats inside our blood and create certain chemicals. Okay. These chemicals are called, it's called an oxidative stress process. Right. Advanced glycation in products and stuff like that. These are bad chemicals that actually cause inflammation in your body. And that inflammation, is not good with the cells. The repair of these cells is affected. So they don't repair well. They start getting damaged, start getting destroyed. So the blood vessels, the nerves that are supplying the heart. So heart attacks, heart failure, are the two most important cardiac complications that can happen with diabetes. In terms of brain strokes, again, a big factor that actually can increase mortality. And end-stage kidney disease, kidney failure, what we call, is again, diabetes is one of the big ones. And nerve damage, what we call neuropathy, and erectile dysfunction, infertility, and eye damage, vision loss from all the changes that happen in the retina. And these are the main life-threatening, organ, damage that can happen with diabetes. So, like I said, most of the times they don't happen overnight. So there is time, even if you have been diagnosed with diabetes, you can work on it. You can keep it under control and reduce the risk of all these complications.
Right. Doctor, that raises one more question, which is, obviously we are a population with large number of diabetics, and people are in diverse, careers. Somebody is working in a factory, somebody in the farm, somebody in a corporate office, somebody is into sales, and somebody is into high stress environment. Everybody has their own set of problems in their career and all that. So whom do you find more prone to, facing those life-threatening conditions, especially people? Is there a correlation between the career and the life-threatening condition that they are likely to face if they are diabetic?
So if you're particularly asking about career, I don't say so, but any high stress jobs, they are definitely more prone for the complications. But again, complications depend on several factors. One is how well controlled your diabetes is, and how much of care you're taking in terms of exercising or diet changes, how well your blood pressure is controlled, how well your cholesterol levels are controlled, how often are you monitoring your blood sugars. All these actually factor into it. So, and again, family history matters, but high stress and environment in terms of workplace is an additional risk factor, for all these complications.
Doctor, the other concern that we usually come across is self-medication, right? People, once they discover that they are diabetic, they would have consulted a doctor for some time, followed up with the doctors, taken medication as prescribed, but over a period of time they become a bit careless, and they probably end up doing self-medication. Or sometimes they may not even ask a doctor. Some blood test somewhere indicates high and they start doing self-medication. What are the situations that you have seen where the self-medication, I know what I am doing kind of patients, what kind of problems they end up eventually facing, and what do you advise them to do?
Okay, so this is quite common actually. My sugar is, they happen to, check their sugar, and, it was coming high. So I took 2 tablets instead of 1. Like, I was just taking 1 a day. I've increased it to I've been taking twice. Now, they don't know what the maximum daily dose of each drug is. Okay. So unknowingly, they may overdose. Okay. So that is kind of risky. And I had another patient the other day who said, I was taking these medications, but then my friend has been taking these medications. So I actually took her medicine and tried it, and it worked. But then I started having burning in my urination, and I got scared and came to you. And the last time she saw me was 1 year ago. So it is quite common where, either they're not monitoring and they think that I'm doing fine, or, they get these ideas where they take, instead of once a day, 2 times a day, or somebody else's medication because they said it's working better for them. But, every drug has its own set of side effects. So make sure that, you have some kind of medical supervision when you do, when you have to change your medications. Please don't do it yourself. And because a daily dose of each drug, a maximum daily dose of each drug is different. So you have to be careful there. And certain medications are contraindicated in certain conditions. And if you do not pay attention to that, we'll end up in problems. And sometimes when the drug gets overdosed, you may end up having a low blood sugar or you can get certain drugs actually have some certain side effects. Well, if you don't see the doctor or don't get educated or counseled about those side effects, then you can get things like vaginal infections or urinary tract infections and things like that. So it has to be supervised. That's what I would say.
So doctor, there's one more question I want to ask you. So typically, while doctors say go for a checkup every year, understand your health condition, etc., given the lifestyle, given incidence of diabetes that we've been talking about, what kind of checkups you believe people should undergo? Should it be annual? Should it be biannual? Should it be monthly? What do you suggest?
So what I would say is, in order to avoid these life-threatening complications, if you already have diabetes, right? So make sure the blood sugar is under control. So typically what we follow is, hemoglobin A1C level. That's a 3-month average in terms of blood sugar, how well that control is. That is every 3 months. Make sure it is under control. And blood pressure at the same time. Cholesterol levels should be under control. And once a year, we would recommend eye exam for the retina screening. And once a year, we would recommend urine test to see if to detect any protein that is going in the urine. And people have to take care of their feet, look at them every day before they go to bed and make sure there's no cuts or wounds, that they miss, and bring them to the attention of the doctor as soon as they notice something. And these are a must. Okay, and based on your risk factors, your doctor will recommend when to get a treadmill test, when to get a 2D echo, when to get an angiogram and things like that, based on your symptoms and your risks that are involved.
There are patients whom you would have seen, they take a tablet, and there are some who take insulin. And at what stage do you suggest that the patient better switch from a tablet to an insulin shot daily?
Again, it depends on the case. For type 2 diabetes, we typically start with lifestyle changes and oral medications. And we usually try to pick the tablets that actually have less side effects and be beneficial in other aspects, in terms of there are as compared to 20 years ago, we have a lot more medications available for diabetes, and certain classes of drugs have been actually shown to be beneficial for heart and kidney protection. So we usually try to pick these medications instead of the ones that don't have such benefits. And we try to pick medications that don't cause weight gain as much, because a lot of diabetes patients are already dealing with obesity or overweight. So we try to pick medications that don't cause weight gain. And depending on the patient's profile, we start out with tablets. Again, once we say exhaust all tablets, okay, or oral medications, then we sometimes do start insulin. But before that, actually there is another class called GLP-1 agonists. There are oral medications and injectable medications in that class. These are the once a week injections that we have available now this year, tirzepatide and semaglutide. So these have been very useful in terms of preventing at least some people from progressing into insulin. Okay, because insulin does not have any mortality benefit. Insulin does not really protect your heart or your kidney from diabetes, but there are certain classes of medications that can. So we try to use them first, and even then we're still not able to get to our target sugar control. Then we have to move to insulin.
So doctor, that brings us to one more question. What are the must-dos that a diabetic patient should ensure?
So a few are must. They should not be compromised, I would say. One thing is taking care of their diet. Second thing, exercise regularly, minimum 30 minutes every day. And third thing, monitor their blood sugars regularly and have their checkups, like I said, blood tests or eye exams or urine tests or whatever that is, on time. And get adequate sleep, and stress management, is very, very important. Okay, so stress management, again, is it workplace, is it family? Like, you have to work on what helps relieve your stress, in the sense, for some it's music, for some it's exercise, for some it's meditation, yoga, or whatever it is. Again, sleep, stress management, do not forget, other than diet and exercise, and checking your sugars regularly. Those are the must-dos, I would say.
Then I land up with one more question. As you all know, STAR Hospitals is a multi-super specialty tertiary care, rather quaternary care center. From simple to most complex treatments, surgeries are performed here, including organ transplant. Doctor, tell me something about how do at STAR Hospitals patients are managed with respect to their diabetic condition when they especially come in for surgeries?
So we usually try to assess their sugar control beforehand, and make sure we counsel them with their diet and exercise and medication changes to get their sugar under control before the surgery is planned. And emergency surgery is a different story. Again, we are talking about elective surgeries, which are planned ahead of time, and it is usually a multidisciplinary approach. They get to see a dietitian, they get to see us, they get to see all the different specialties that are in need, that the patient has to see in regards to their condition. Make sure we optimize them in every aspect, and then prep them ahead, and then take them for surgery.
So you heard the doctor. Diabetes indeed can become life-threatening. If you are a diabetic, it's in your interest to take necessary precautions so that you do not face situations in the unlikely event of you requiring hospital care where you need to undergo surgery. Diabetes should not be the reason or the cause for delaying that surgery and complicating your health much more. So it's important you take preventive measures, manage your diabetes. The must-dos which the doctor highlighted are must-dos. If you do that, you will certainly lead a healthy life and manage diabetes very well. So that brings us to an end to this podcast session on what life-threatening sessions can diabetes lead somebody into. Thank you so much.